Welcome to the maiden edition of Last This Week.
And what he is praying now is
that in this scenario, the key of Kano State
will be given priorities and so that at the end of
In commemoration of this year's World AIDS Day, the federal government has launched a national policy document towards strengthening national response to HIV and AIDS, viral hepatitis, and sexually transmitted infections (STIs). The Minister of State for Health and Social Welfare, Dr. Tunji Alausa, in his address, said the theme of this year's celebration, "Let Communities Lead," is an urgent call to action to take charge in the fight against HIV/AIDS. Says Nigerians cannot achieve lasting progress in our battle against HIV and AIDS without the active involvement of our communities, as they are champions of change, the catalyst of progress and the backbone of our collective resilience.
With your support, so many lives have been saved across our country and significant impact made. The government of Nigeria will continue to work with you to address the numerous challenges that affect quality HIV/AIDS services in order to secure a healthier future for Nigerians living with HIV. Other means of progress have been through the scaling up of numerous interventions and services. These include HIV testing services, prevention of mother-to-child transmission of HIV/AIDS, treatment, care and support, pre-exposure prophylaxis, condom promotion and distribution.
Dr. Alausa, who launched the policies, said it is aimed at reducing the spread of the diseases and to effectively manage their impact. The minister noted Nigeria has made significant progress, with over 90% of people living with HIV and AIDS on treatment, and many Nigerians now knows their status.
Community contribute to HIV/AIDS response in numerous ways. Their leadership and advocacy ensure responses remains relevant and grounded, keeping people at the center and leaving no one behind. We cannot achieve lasting progress in a battle against HIV/AIDS without the active involvement of our communities. Our communities and community structures are not merely recipients of care, they are champions of change. The catalyst for progress and the backbone of our collective resilience. Communities include peer educators, network of people living with HIV/AIDS, key populations, adolescents and young people, counselors, community health workers, door-to-door service providers, civil societies.
He further expressed need for preventive activities and treatment of AIDS reinvigorated in the country and the world at large to stay on the fast track of ending AIDS epidemic by the year 2030.
And consolidate our efforts to end HIV/AIDS by the year 2030, in line with global strategy for HIV. Through our collective actions and responsibilities, we can eliminate HIV from our great country, Nigeria.
Chairman House Committee on AIDS, Honorable Amobi Oga, called on government to do more by providing funds to assist the treatment and elimination of HIV and AIDS.
I am aware of the target to eliminate mother-to-child transmission of HIV/AIDS by year 2030, and the fact that the national coverage of prevention of mother-to-child transmission is less than 50%, leading to about 22,000 cases of mother-to-child transmission of HIV every year in Nigeria. We are not unmindful that over 90% of funding for HIV/AIDS activities through programs in our country come from foreign partners. I therefore call on the federal government of Nigeria to look inwards in supporting domestic funding, because it is high time we decide our fate and not to over-depend on foreign aid, which does not do us any good.
Comfort Olayinka, Eco Hot TV.